Okay, welcome to the SDA clinic in Chuuk. This is the lock. Key number R32 is the one that opens it, lets you into the complex. So you just open that, go on in, and over there is the dental clinic. And we'll walk over there. Just set this up in June, and then today we received our approval from the government, from Dr. Skilling, the state hospital director, and Dr. Yalbert Inlet, who's the director of dental services, came and toured the facility, and tomorrow Dr. Skilling will give us our certificate, and so the clinic will be ready to go. I'll take you over and show you how to set up the clinic. The clinic is set up to run on both shore power and on power from our 20K generator, which is located right here. What you see coming out here is the wastewater for the clinic, and then next to that is the freshwater inlet that we have off of the city water here in Chuuk. So we're set up here for shore power in and shore power out. The bottom one gives power to the house next door. The top one is the power to power the unit. That's the outside air conditioning unit. And then inside here you will see the main switch. Down is shore power, in the middle is off, and up is generator power. You want to make for sure it's in the generator slot before you turn on the generator. This battery may need to be charged occasionally. There's a charger right below that you can see on the bottom there. Just hook up those two connections to it and it'll be ready to go. This is the dry vac system and the ultra clean air compressor up there at the top. That other box in the back is our hydraulic unit, which runs the hydraulics to lift it up and down. Okay, so we're currently running on shore power because it's down, so you can go in and turn everything on in the clinic. Switch it to off. That closes the louvers on your left. And then switch it to generator. Then you step back down here, open up these handles for the generator, turn them. Then you'll see a switch here that says start, stop. Put that to the top and it will start the generator. Takes a little while. You want to hold it on for some time, then close this up. Louvers automatically open to get circulation. If you ever need to order diesel, the diesel goes right in here. We'll now go up to the front and open the clinic. There's a key on the key ring for the generator room, and there's a key on here. This main one right here is the key that opens the dental clinic. And you're able to enter the dental clinic. We're operating on generator power right now, so we'll switch on the light right on the left hand side as you come in. Here is our waiting area. Extra supplies where clients sign in here at this table. Oxygen unit for in case anyone is in need of it. First chair, high power suction, and also water air syringe. 2 is the program for patient position. 0 is to take it down to the regular height for the patient to get into the chair. You'll see the water bottle, which can be filled with bottled water preferably, or distilled water if you actually find it in Chuuk. And then we have our supplies here on each side. We're set up with most everything you'll need. There's the curing light, eye protection, sunglasses for the patients, different surgical and sterilization materials on each shelf here, the amalgamator, and the masks, trays, and bibs. We also are set up for digital x-rays. These are x-rays taken here in Chuuk. Here's the ultrasonic cleaner, and it's hooked up to the second chair. And we also have the unit for the Airbex x-rays. So we have an x-ray sensor, digital x-ray sensor from Dexis that goes along with the software program that will be used for taking x-rays when needed. The x-ray is set up with a handheld x-ray. The process is to load the blue DeWalt battery charger to the unit. You'll see right down here on the left hand side of the computer is the DeWalt charger where we charge the batteries. To enable it, you'll push the enable button, and to take the picture you can either use the trigger or the green button on the top. You set your exposure with the red buttons going up and down, usually 11 or so. And we have all the holders for the x-rays in this Tupperware container. Extra supplies down here for amalgams, sedation, etc. Additional syringes, and all the other materials are either here or back in the sterilization room. Sterilization room light is right on the right hand side as you enter the room. Flip those both on. This is storage. This is where we keep the gowns, the disposable gowns that can be used. We have ultrasonic cleaner, sharps container, gloves, the different sterilization packets. We have Ritter Midmark 9, M9 that we use for sterilization. Use this fan here to keep it cool and from too much steam building up as you're using it. There is impression material and files in this particular cabinet right above the sterilizer. Over from that you'll see extra pedo surgical equipment and adult surgical. There's also cassettes in here, as well as extra instruments that have been sterilized that can be used, extra files and so forth. And over here we have the Septident, lidocaine, etc., needles, different gauges for depending on what you're looking for. We have a pulp vitality tester. Down here in these drawers you will find extra burrs, the high-speed drills. Those are all in the first drawer. Second drawer has mostly the bibs and the trays. There are extra trays here that are ready to go. Patient notes kept alphabetically in the third drawer in order there. Down in the last drawer is mostly cleaning supplies. Here's the extra gloves, floss, etc. This is the space where we keep the tank and a few other things. And hot water can be used through this system here at the sink. Extra cavi wipes are found back in here too. It's running off of city water, so you can utilize it just as you would any other regular faucet. You don't have to worry about the tank running out. In here is the on-off switches for most of the different items. 18 and 19 is the HVAC system. 6 and 8 are the vacuum pump, and 2 and 4 are the compressor. Those are the 240 and this is the house power out right here. So I can power the house if need be right there on these two, on 13 and 15. They're all labeled here, everything from the lights to the chairs. Chairs will need to be turned on when you come in, and they're number 14 and number 16. 14 is the rear chair, 16 is the front chair. Main circuit will also need to be turned on when you first start up here at the top. So that pretty much concludes the quick tour of the Chuuk Dental Clinic. We also have the house next door, which we'll go over there now, and I will show you the inside of the volunteer house. Also, when patients come, this is the only restroom that they can use will be down here, so don't keep any valuables down here. Gotta go back and get the keys. Okay, the house key is like so, regular house key with house on it, written on it, if you're lucky and have that set of keys. Okay, now we're entering the lower part. Here's the eating area, big eating area. There's the refrigerator with freezer, the bathroom, and there's washer dryer in here as well. So there is your toilet and breaker box for in the house. It's very simple. 220 upstairs, 100 downstairs, dryer, kitchen, spare. Main switch at the top, just like any other switch box. Here's the shower. Hot and cold water. You got to make for sure you turn the hot water on and off so we don't use too much electricity. The light switch is up at the top of the light. You turn it on at the light. You can do your washing and drying here. This strip here controls all the lights. You can turn it off at the one switch or turn them off individually if you're not. If you're too short to reach them, that will be your option for turning them off. You can turn them on here. This is the kitchen area. There's a microwave. Very simple. Sink. Countertop. Underneath the countertop you will find miscellaneous cooking supplies and a hot plate with 2 burners. There is a hot water. You'll want to make for sure that you have the hot water plugged in. It is the gray one at the top. When you're taking a shower, you want to get that set up before you actually take the shower and turn it on so that you have hot water. You can control the temperature down here. From ideal is the best place to keep it. When I'm not using the shower, I turn it down to off. Usually turn it on in the morning. Heat up the water for your shower. These are the stairs going up to the volunteer bedrooms. There is a light right here that can be adjusted on and off by twisting it. There's the first bedroom. The beds are roughly 5 feet by 7, so I think that's a double bed. It's the first bedroom. Second bedroom, same exact floor plan. Third bedroom is where right now I'm actually drying sheets for the beds. There are 3 beds, one pull out from underneath, the middle bunk, and the top bunk. So there are 3 bunks in here with a light, just like the lights below. Reach up, turn it on, turn it off. And then the main bedroom with cross ventilation and a fan as well is, I believe, probably a queen size bed. And so you need to plan accordingly. There are loose sheets and so forth that you can use. 2 windows. Make for sure that the windows are closed if you're not close by to shut them if a big storm comes, because otherwise you could flood the unit from the water coming in at the right angle, or you could have a very wet bed. So those are the sleeping quarters. Very simple electrical system. You need to be careful going down the stairs at night to get to the only bathroom in the house. And that's pretty much it for the Chuuk volunteer housing. Over here is the shipping container. It will have a master lock on it. Use the key opposite of the one that you use on the front gate, since they're both the same type of lock but different keys. Inside you will find all sorts of miscellaneous supplies. Normally the car is in here. The car will need to be checked many times. It may have difficulty starting because of the electrical and all the moisture and heat from it being kept in this place for 5 months or however long it has set between volunteers. Hopefully we'll have lots of volunteers and won't have to worry about that. But there are miscellaneous carpentry, extension cords, and etc. back in here, extra building supplies from when we built the house in 1 week. It's located on a rather large lot, as you can see, with complete fencing and barbed wire at the top of most of the fencing. It's a very nice setup. We encourage volunteers to come and help us provide services. There are over 50,000 people on the combined islands of Chuuk, 15 to 20,000 here on the main island, all getting dental services from a very small government-run dental clinic. And there are no private dentists on the island. We are the only other non-profit organization, or any organization, providing dental services. So come to Chuuk, help us out. We need you. If you would like further information about coming to Chuuk, please email Randy Meyer at randym@hfdg.com. Thank you.